You're live. All right. Good morning. It is Tuesday, April 8th. This is Senate Health and Welfare. And we're looking at three bills. We have two bills that are really close to vote, mark up and vote, and then another one that we're going to begin marking up a little bit later. So we'll start off. Thank you, Jen, for being here. We'll start off with H96. Why don't you help us?
Great. Jen Furby from the Office of Legislative Counsel. We are looking at an amendment to H96, which is an act relating to increasing the monetary thresholds for certificates of need. And this is draft 1.3. It's on your web page. I'll put it up on the screen and walk you through it. Jonah and Marka. So it is a strike-all amendment. And in section 1, which is where it sets out the monetary thresholds, we had talked last time about combining subsections A and B. Subsection A, an existing law, is a healthcare facility other than a hospital, and subsection B is a hospital. But because the monetary thresholds were aligned after all of the proposed changes, I had talked with the committee and with the Green Mountain Care Board about combining them. So this would now, in subsection A, just say a healthcare facility and strike out other than a hospital, and that there is a definition of healthcare facility for the chapter that includes hospitals. So a healthcare facility of any sort shall not develop or have developed on its behalf a new healthcare project without issuance of a certificate of need by the board. And then it defines healthcare project. And again, because all of the provisions and monetary thresholds were really the same, except that on the top of page 3, there was the specific references to ambulatory surgical centers. So again, by striking out the separate provision for ambulatory surgical centers, they also fall within the definition of the healthcare facility. And so because the cost threshold had been increased to $10 million, this would subject ambulatory surgical centers to the same provisions that apply to all other healthcare facilities. So you have all healthcare facilities being the same here. And so we're repealing the standalone provision for ambulatory surgical centers, which really had to do with instruction, development, purchase, lease, or establishment. And it was going to add or expansion the $10 million threshold to now have them treated the same as all other facilities for all parties of the CON law. And then subsection B would be repealed because this was the hospital only pieces that otherwise aligned with the new monetary thresholds with the provisions of subsection A. That makes sense. We'll stop there for a moment.
Taking out the redundancy.
Taking out the redundancies, exactly. We were effectively saying the same thing in two different places because the monetary thresholds had been aligned. So when they were not the same monetary thresholds for hospitals and non-hospitals, it made sense to have them separate. Now that they are, that distinction doesn't make a lot of sense. It's just redundant. So no other changes to that part. But then in section 2, the exclusions, there had been interest in adding an exclusion for state projects or state-sponsored projects. We're on page 6.
Oh, page 6.
The exclusions. And this adds a new exclusion from the CON subchapter for the offering of a healthcare service or the construction, development, purchase, renovation, or other establishment of a healthcare facility that is owned or operated by the state of Vermont or is funded in full or in substantial part by contract or grant awarded by the state of Vermont. And then and that part had been considered but not included in the House version. And so the committee had been interested in seeing that language in here with a notice provision. So this adds, provided, however, that the state agency sponsoring the project or awarding the contract or grant shall inform the Green Mountain Care Board prior to commencing the project or within 30 days following the execution of the contract or grant. This is giving notice to the board that this project is happening, but not requiring it to get a certificate of need. The theory being that if the state has decided either through legislative action or otherwise that something is necessary, it should not also go through the certificate of need process, but the Green Mountain Care Board should be aware of it. Okay, and then finally, section 3, the effective date. There had been interested in moving it to on passage. So this would now say that the act would take effect on passage and apply to new projects initiated on or after that date. And for projects already in process on the date of passage of the act, for which someone has been granted interested party status, keep operating under the existing rules. For applications that are already in process on the date of passage of this act, where there's no one who's been granted interested party status, the applicant may withdraw. Now,
Okay, questions for Jen?
like what you were
Senator Douglas, yes?
I do. So on the last page, at the top, prior to commencing the project within 30 days, what's the rationale for having two different options of informing your county care board? Because when you're given two different deadlines and it's either or, I think most people that are doing the building project, or if it's the state, I think they could very well just put it off until prior to commencing the project. So I think the 30 days is a little irrelevant.
So my understanding, and I think you have people either in the room or online who can tell you more, is more that it would be the contractor grant may be for the offering of a healthcare service, whereas the other piece would be for the commencing the project would be for construction.
Okay. So it just gives more options.
Yeah.
Otherwise, yes, I would agree that it would be confusing. Either we should
keep on
pick one
checking
or
on it.
else, but yeah.
Okay, any other questions? I'm looking around the room, and I don't see any frowns.
Kevin Green, Beth. I was just curious about the shall do the inflationary factor piece. I don't know if this committee decided on that.
Well, look at that. I don't think that was discussed. I wondered about that as I was working on. So at the bottom of page 5, in existing law, there is language permitting but not requiring the Green Mountain Care Board to periodically adjust the monetary jurisdictional thresholds contained in this section.
This was the should. This was the should. We did add shall, the compromise was should. Yeah, we thought should.
I would really prefer not to put should.
There's somebody.
Yes.
So the board shall reflect the same category.
Well, if you want them to, so it's, no, it's not the shall reflect.
Which
it's
one
the-
is it?
Line 16.
Okay,
Page 5, line 16, the board may periodically adjust the monetary jurisdictional thresholds. I believe the board has historically increased those annually.
so is there anything we want to say?
So if you would, I mean, if you want to, you could say, if you want to make it stronger, you could say is encouraged to or something, but should just doesn't have any
So
more, any.
down below, it does talk about the cumulative consumer price index rate of
Right,
inflation.
any
So
adjustment by the
so
board
there-
shall not exceed that amount.
Yeah, so it's there.
But I believe this is happening.
Yeah.
Is there
Yeah.
concern about this not happening?
The May gives the board permission to do,
It does,
What?
and the
Right,
board
okay.
has been
so
using that permission.
I decline with May.
I'm fine with May too, and so obviously, if there's some issue that it's not happening and the consumer price index rate of inflation has gone sky high, we haven't seen that recently, that then the hospital or the ambulatory surgical care center, or whomever, the facility can knock on the door and say, are you going to review this? It has to be that process. There has to be some communication in there. Can't tell them they have to do it every time the consumer price index changes. So Devin Green wants to raise.
Sorry, but it just says periodically. So it's just making sure that they do it.
They may
There
do
could be
it.
a point where they
Okay.
didn't do it for a long time.
And, part of the long time, it could be board turnover and other conditions relating to the board responsibilities. Oh. If we say they shall periodically, what does that do? What's the period we're talking about? Every 10 years? So I think May gets you further along. Really do. The healthcare advocate wants to weigh in.
No,
Yeah.
I'm good on that topic, but
Oh, you have another topic. Okay, so I'm looking at the committee around the table, because this is where we are, we're at the table. Anybody want to change the may to the shall, and if you, and what would be the reasoning there?
So to play a little advocate for Devon for a second, I do think that it provides consistency and reliability for the hospitals to hold confidence in knowing that it will be dated periodically. Like, I think most of us trust the Green Care Board to be able to do that reliably. But I think it gives some confidence to the people that are interested in it have it. But I don't have to think, but I don't know.
I think with the periodically, it's non-specific enough that I'm not, excuse me, I'm not sure there's a substantive difference between may and shall here. I think if you wanted to say shall and give some more specific,
Could say shall
Timeframe.
annually. which
right, you could say
shall.
shall annually, you could say something else, you could leave it as it is, you could.
Something goes wrong.
Yeah.
I mean, we can always change things. I mean, the consumer price index might not go up,
Right.
but construction materials
Mm-hmm.
might
Mm-hmm.
blow up. So I
It
think,
might be a tariff.
yeah, it just might be a terrible.
Right, so the language in here currently limits the board's adjustments to the cumulative consumer price index rate of inflation. So if there was increase in costs of goods that certain goods that were not reflected in the overall rate
Or
of inflation.
other economic indicators.
Yeah.
Yeah. I think we start getting into, taking a whole new line of testimony. on this one. Yes,
I can't stop, Mike Fisher, healthcare advocate, I can't stop myself from trying to make things better. I like nay, I think it's fine. But in the interest of this discussion, shall consider annually.
oh, I don't think annual is the right.
I'm just, but doesn't tell them to do it, just tell them to take a look at it.
Well, we already have, they may periodically adjust. This is adjustment.
Right.
This isn't even
Just
consideration,
discussion.
this ain't doing it. So I think the may fits perfectly fine, and if you have shall there, I'm not gonna change it. And if there's a problem, we're gonna hear about it, right? Yes. We're changing it now. And if something,
We're not changing.
yeah,
Leaving it alone.
yeah, so we'll leave it. Well, a straw poll, who would like to have, leave it as it is with may? Who would like to make it shall?
Do you have a third option?
No.
You can go back to should.
We can go to show.
No, I'm more ambivalent. But I
can
think,
tell.
yeah. Well, I think there is a point to what Devin's saying, but I also think there's a point to what Mike's saying. And I think it'd be a good conversation to have a little bit longer.
Uh-huh. Yeah, so it does move into the whole paragraph and the meaning of that, so let's just leave it. We'll see what, maybe we'll get to conference committee.
This wasn't in the house version, so I don't think you're going conference specifically for that.
That was facetious.
I know. Is there anything else somebody wanted to look at in the
Is
language?
there anything else in the bill that you'd like to bring up? I'm looking with this, okay, so Mike Fisher would like to. bring something up.
A question for the committee, if you have thought of this and decided against it, I'm good. What I wonder about our recommendation about closing the loophole on conditions. So that when the Green Mountain Care Board says that a facility can operate under these conditions, that's not limited to the final report of the CON.
So the CON ends on a specific day. When that goes into operation, the CON ends. Did we have that in S63? Well, that wasn't
No.
there.
It was one of the recommendations.
Yeah, no, thank you.
There's a recommendation from the advocate's office, and
Yeah.
I feel like the board addressed
And the
it
board,
by
no.
by email, but I can't remember. So I'm looking for it.
So let's leave that one for now. It is something that might come back for a broader discussion. There's pros and cons. Okay. I did. You can on forever.
You good?
I'm good.
Yeah, okay.
Just make it clean version.
I will make a motion to pass draft 1.3 of H96 favorably out of committee.
Okay. Discussion? Okay, we're,
2 seconds.
We don't have those.
we don't need it.
I like that second.
Who would like to second that? Anybody? Okay,
I will call the roll. Please say yes or no. What your name? Senator Hart,
Yes.
Senator Cummings,
Yes,
Senator Douglas, Senator Buell,
Yes.
and Senator.
yes. Now, the only thing that we need is good report. Would like, you want to do?
No, only if no one else wants.
Senator Douglas was the, that'll be good. Okay, good, thank you, that's a great
Go
guy.
ahead, clean version, which I will finish later, because you want to move on to 13 before I get all up to the
Yeah,
forward.
yeah, let's see what we can get accomplished here.
Great, some, I think fairly minimal amendments. This is H13, an act relating to Medicaid payment rates for home and community-based service providers. And so most of the changes in here, in this strike all amendment are based on recommendations from the Agency of Human Services. Which for one thing suggested not using the phrase home and community-based services because it does have such a specific meaning in our Medicaid waiver and in the Medicaid program generally. Since our definition here does not align with the definition of home and community-based services for purposes of the Vermont Medicaid program. So based on that, I have changed the terminology throughout to just community-based services, which was their recommendation. But with the same definition. That you risk.
no, it's not loaded. Something happened.
You want to keep it for that?
On page 2, as part of the definition of what is now community-based services, there was language in the bill as it came over from the House that was, I thought was sort of problematic. It was about short and long-term services and supports provided to individuals with mental conditions, individuals with substance use disorders, individuals with developmental or intellectual disabilities, and individuals with brain injury in a home or community setting. All of that I think is fine. For which the Medicaid rates are not otherwise established pursuant to statute or rule. And my concern that was raised by a House member, and I thought was sort of interesting, it becomes a little bit circular because once rates perhaps are established by statute or rule, then they would no longer fit this definition. So we changed it. This is a proposal to change that to that is not a clinical residential setting or a private non-medical residential setting, which is really the categories that were to be carved out. So this was the suggestion from AHS of how to address that situation without making it potentially.
Do we,
a little circular.
the definitions for non-medical residential settings and,
We do not define, I mean, I think those are known terms.
those
in-
are they in our, they're in our statute?
I don't believe they're in our statute. They may be in our Medicaid state plan.
They're in our Medicaid.
I mean, they're okay, right, Medicaid terms. And then section 2 carries that change throughout to take out home and, so we'll just be talking about community-based services. And then the change on lines, starting on line 13, is really my suggestion, because every time I did a walkthrough of this bill, it seemed sort of repetitive. And so it really seems like we don't need to specifically and separately say both that the secretary shall determine these payment rates that are reasonable and adequate. And when determining these payment rates, the secretary shall do certain things, and then repeat it again, saying when determining these reasonable and adequate rates For these same providers, the secretary may consider other things. So I structured it instead as one subsection where the secretary shall determine rates, and when determining the rates, the secretary shall adjust them to take into account specific factors, and then may consider geographic differences. I think it flows better, but it's not a substitute change.
Oh, that's cleanup.
Yes.
Yes, statutory.
And then I think that is really it. I specified provider of community-based services using that same term again, when looking at the extraordinary financial relief. And then I've suggested changing the name of or the title of the bill to just be an act relating to Medicaid payment rates for community-based service providers. So making that change to remove home and throughout, and doing the cleanup piece and doing what I consider sort of cleanup on the definition.
So all of the language that is struck on page 4 and 5 is part of the cleanup.
On page 4 and 5 is mostly just taking out the home and. And then
I'm looking at section 3.
That's the reason we add.
In section 3.
in section 3, nothing changes in section 3.
Okay.
I mean, that's all
Oh, it's just,
from, I mean, that hasn't changed since the bill came over to you.
right. So
And
can
that's
you talk
taking,
about the reason for doing that?
sure, that's the language that is being folded into this existing language around rates of payment to designated and specialized services agencies. We would otherwise have parallel language in Title 33 and Title 18. So
Right.
instead, it just says, look at the language in
Right.
Title 33 in our new section. That is it.
Okay. And the date is on passage.
Date is on passage, yes. With the report coming back in January.
As a report.
Suppose a curiosity question, why the title change?
Because the title of the bill refers to home and community-based service
Right,
providers.
okay.
And so it's just going to be consistent.
Okay.
I don't think it will affect its validity, but it better reflects what's in it.
Is there a fiscal note with any of these?
There is
Yes,
Which one?
both
Both? Okay, well, we'll have, oh, God.
96.
I just
Yeah,
read this one.
revenues lost.
Oh, right.
So, but that 96 got finance probably.
Okay. Okay, so let's look at this one and then, Nolan, we should probably look at the fiscal notes for both of them, even though we voted on one already, we should go back and look at it. But are there any further questions for Jen on page 13?
And work on the clean versions of both of these decisions.
That'll be good. Okay, so Nolan, why don't you share with us?
Okay.
I failed on my webpage.
Do you need me to send them to you? Do you have,
You got it here.
what's that?
Have done.
I don't know, I wasn't.
Can you send me the Zoom? I don't
I'm
have.
going to go to the tour, but feel okay. Anthony, come back. Okay.
Thank you. So there wasn't one for 96, but there
There's one for both.
is one, because we only had. Yeah, okay.
Which, want we do 96 first? Which one would you prefer me to do? They're both quick, neat.
Okay.
So which one would you prefer me to do first? 96?
Let's go to 96 first.
Okay. Okay. refresh my memory on this. So this was the loss of revenue from fees tied to CON. So over the past 7 years, the board has collected approximately $50,000 per year on average in fees related to the review of CON applications. They estimate that the bill could reduce this revenue by as much as $20,000 per year on average. However, according to the board, this loss can be absorbed, and the decrease in CON reviews would allow resources to be deployed elsewhere. So that's basically this. So it's just the loss of revenue from when you increase the threshold, there's less CONs. Less CONs means less fee revenue. The fees are under statute or charges of filing a fee for filing CON applications. It's calculated at the rate of 0.125% of the project costs. On average, the fees have ranged from a minimum of $250 to a maximum of $20,000. All fees are deposited into the Green Mountain Care Board regulatory and administrative fund. So, again, it's a revenue loss. The board has told me they think that can be absorbed within their budget, and conversely, it relieves them of staff time to be able to do other things.
We
So-
need them to do other things right now.
Yeah, so, but that's all based on what they've told me. So that's the 96 fiscal note. I assume this would probably go to finance and be in and out and quickly.
Well, I,
You
yeah,
didn't say that to us.
good, we'll get you something.
Yeah.
Okay, that's good. Any questions on that one? Right.
Yeah, go to finance, right? It'll make us.
Only the Secretary of the Senate knows, but we've had things with less impact come to us. It should.
Yeah.
Okay. Well,
Sorry, DA.
Yeah.
Somewhere.
the other note,
So we go to H13.
this one, this is just passed by the House. I haven't followed the progress on this,
Okay.
but basically, the point on this one is if the bill does require secretary to determine reasonable and adequate rates for home and community-based services, and we're gonna call them community-based services. But, and while the bill also requires AHS to establish a process for doing this, whose financial conditions place them at risk. But it doesn't require them to actually put the rates into place. So that's the difference. They're doing all the work to determine what the rates would be, but they don't actually, the bill does not require them, nor does it appropriate the money to do that. So this is like setting the stage for rate increases, but not actually requiring a rate increase. So it's that point meaning that there's no appropriation because it's not a shall. There's no shall increase the rates. That's kind of this similar bills have been in human services in the past, and it didn't make it past appropriations because they did require the rate increase, since the appropriations committees at the time determined that went in with the red list of everything else. So that's the difference on this one. The other piece, which I will say, is that there was a question I received or CC'd an email this morning from AHS and DEBA, and they expressed their concerns about their ability or capacity to actually do this work within their use. So they're not asking for an appropriation. They're just saying that they have a lot on their plate, and they sort of flag their ability to actually be able to do this level of work. So along with some of the other things, it wasn't necessarily this alone. It was unclear from the email, but it was saying all things that are coming at them, they were unsure if they can do all of the things that were being asked. So, but again, I would defer to them to make that case. I'm just talking about an email that I was privy to.
Do you think it'd be worth having them talk about that in person?
It's up to you guys. I don't know how quickly you want to vote this out, or.
I think we should move ahead with it. I do think, I'm trying to look at their testimony.
It was, the question I think that had been asked was, could they do the amount of reporting requirement that was in both 99 and 13? And the message I'm getting in the email is doing both of those bills would be a lot of time. So that's the question for them is, if you
Which two bills? You're talking about 99? Yes, I did get it. I
they had
got-
said both of them, like they said,
Right,
both those bills would create capacity concerns.
right. H9.
But whether they could use one, I believe it.
Yeah.
Which is why when I brought it up to them when they were in the room, it was the language from 99 have a different due date, like a month, like a different year. So that way they would have the order to do it, but they would be able to do H13 first at their own pace and then do the other study at a later date.
Yeah, I mean, that's one way to resolve it is you could just change the effective dates.
Yeah, that's what I mentioned too, right? They're not cool, was it?
Or just have the effective dates for both of them be like far out so they get some space and they can decide which one's first, or maybe you prioritize, that's up to you. I know that they're both important to you. So
Well, I know that the House passed 13 already, so I definitely give priority to that one.
Well, and I'm agreeing. I think S99 is a huge amount of work. And if we send it over to the House, they're gonna have to go through a lot of what we just.
so
Oh,
I'm just flagging that.
my suggestion, yeah, no, you're right. I think what we should do is to go ahead with H13 and keep S99 on our wish list for next.
Or just have them come in and say,
I have
Okay,
an
without-
email. I've got their email. I'm gonna post it. I haven't sent it to Keith yet.
okay.
Yeah.
That's all, just flagging.
Yeah,
But like I said, I didn't look at your version of the bill. I'm guessing that it's similar and that you are just asking them to do a rate study, but in nowhere in there does it require them to implement.
exactly.
So to that end, there's no appropriation required.
Okay. All right, so let's move ahead. So do we have a motion?
Can we, you want to make that?
Have we made a motion on this?
No, we haven't.
Okay.
On 13,
Yes.
okay. And we're going to send it forward, even though we know they might not be able to.
No, this one they can do. The question was putting S99 on, which is looking at a pretty extensive cliff study.
Okay.
And I will get that email to us.
And if I may add to, at no point when the bill was in the House, was there testimony from AHS that they didn't have the capacity to do it?
Right, and I haven't seen anything
Oh.
from them on that, but I think that adding the S99
Yeah.
into the mix made it
That's
complicated.
the point, I think.
Yeah. So let's try and stick with what we have here and then we will move ahead.
Okay.
I'll second.
All right, now discussion.
What are we going to do about the overload if we pass this?
Well, this isn't the overload.
It's 96 that we just passed.
No,
99.
99, which
Okay.
is not, we are not putting on here. S99. Once I can get you the email,
Okay.
you'll get there, you'll understand this thing.
Their concern was overload, which is why when they were in the room, I mentioned preventing the overload by having a further out due date, so there would be no overload or even overlap of the two studies. And frankly, I really don't see a reason why we couldn't do that if we had a long enough due date. If your just was a reasonable due date. Because
That's a good suggestion, and we're gonna hold that suggestion for when we take up 99. I know you really want to do that, Bill.
helped us too.
Don't speak for me in public, I'm live.
I know.
What
Okay,
I can do for, I'll talk to you.
okay, so let's, clerk.
Yes or no, when I say your name, or your heart, yes. Senator Cummings,
Yes.
Senator Lee, Senator Hewitt,
Yes.
Senator Lyon.
Yes. Okay.
Five is zero on both those.
Oh, okay. All right, so, then I'm looking for,
Happy to report if no one else has a burning desire.
so. Anyone else want to report this bill?
On later, and another one.
It's beyond
Huh?
it's beyond my,
It's beyond
Oh,
your
if it's
ken?
beyond your understanding, then I'm not sure I'll do it.
Okay, well,
Medicaid rates.
you are welcome to do it, Senator.
Okay.
We're gonna go back and forth. Good, that's good. And I know that, the Cliff study is important.
But that's a separate,
We'll come back.
yeah, it's a separate.
We will come back to it. No questions about it. And, so we have Michael Brady coming in at 11, so let's take a 10-minute, break.